Hi, my name is Carrie D'Amelio. I'm 19 years old and I was diagnosed with Crohn's disease in the summer of 2009. Crohn's disease is an autoimmune disease of the digestive tract, which means that my body produces immune system cells that attack my healthy cells and cause inflammation in my digestive tract.
Crohn's disease was first diagnosed in 1932. It belongs to a group of conditions known as inflammatory bowel disease. General symptoms of Crohn's disease are fever, loss of appetite, weight loss, and fatigue.
There's still a lot of ongoing research about Crohn's disease. Researchers aren't sure at what age it comes about or who gets it, but they have found that it is most common in Jewish males. But it's not like chickenpox or anything where mostly little kids get it. Anyone can get it, they're just not sure how yet. There are a lot of options to control Crohn's disease, but usually at first the doctor will prescribe a steroid to get it under control. And then once it's under control, depending on the severity of your case, they'll prescribe you a different medicine. Usually they give people with Crohn's disease an immunosuppressant, or if it's more severe, there's intravenous medications and injections, and in some cases special diets work, but they don't work for everybody. Crohn's disease itself is not fatal, but if you don't take care of yourself, it can lead to infection, which could be fatal, but I don't think the disease itself is fatal. The first time I was admitted into the hospital was in the summer of 2009. That's when I actually got diagnosed. We took me to the ER because I was really sick, and they thought that maybe I had a stomach virus or something. So they ran some blood tests and stuff like that, and then they scheduled a colonoscopy and upper endoscopy. So a couple days later they gave me that, and from that they found out that I had Crohn's disease. And immediately they put me on steroids, and it started to get me under control. And I was in the hospital for about 9 days, I think, and then they sent me home with some other medicines. And then about a little over a year later, I relapsed. And except for this time, I knew what was happening. The first time, I didn't really know what was going on. So I went to the ER again, and they began giving me steroids again. And they realized that the medicine that I was on for the past year was no longer working for me. So they prescribed me a new medication. And I was in the hospital for about 11 days that time. I take a few medicines to control my disease. I take Delzicol, which is an immunosuppressant. Since I said that my immune system attacks my own body, it actually lowers my immune system cells, so I don't have much of an immune system to attack my body. I'm also on mercaptopurine, which is actually a really, really low dose of chemotherapy, and it slows my cell growth as well, so it can stop attacking my body. I'm on Prilosec, which is for heartburn, and I take folic acid. I do have a lot of struggles that come along with having it. Not necessarily right now because I'm in remission and I'm healthy, but while I was flared up and really sick, there was a lot of times where I couldn't do what all my friends were doing on the weekend, so I had to sit in by myself because a lot of my friends decided that they didn't want to sit in with me anymore, so I lost a lot of friends due to it. I've also missed a lot of school time because of it, but thankfully all my teachers and stuff helped me get back on track. But there was a time when I was first diagnosed that I thought that I was going to have to be homeschooled because I missed over a month of school, and it was practically impossible to catch up on, but I did anyway. There are certain things that my doctor tells me I'm not allowed to eat either. I'm not supposed to eat anything that's too hard to digest, like popcorn or peanuts or anything, because they can get caught in my digestive tract and cause infection, which could end up being pretty bad. And after a while, you come to know your body and what you can and can't do, and I've realized that a lot of milk products bother me, and they give me really bad heartburn, so I have to stay away from a lot of things like that. I'm not really the type of person to complain about my disease or talk about it much. I usually only talk about it unless people ask, just for the fact that I don't want people to feel bad for me or treat me different, because I'm just the same as everybody else. I mean, I have to take medicine for the rest of my life, but I still do everything that everyone else my age does. I get up for school every day. I have a job. I'm an A student in school as well. So just because I have a few bumps stopping me doesn't mean that I'm not doing what I have to do still, and I'm still getting everything done.